Urinary tract infection (UTI) is an infection that affects any part of the urinary system, including the kidneys, bladder, ureters, and urethra. UTIs are common, particularly in women, and can range from mild to severe. Although the UTI can be uncomfortable and unpleasant, it is generally treatable with antibiotics. Left untreated, however, the UTI can lead to more serious complications, such as kidney infections. Types of urinary tract infection: cystitis, bladder infection. This is the most common type of UTI and occurs when bacteria infect the bladder. The infection often causes symptoms like frequent, painful urination and a feeling of urgency. Urethritis, urethra infection. This occurs when the urethra, the tube that carries urine from the bladder to the outside of the body, becomes infected. It is often caused by bacteria that travel from the anus or genital areas. Pyelonephritis, kidney infection. The more serious UTI that involves one or both kidneys. It can cause fever, chills, and back-side pain. Pyelonephritis requires more aggressive treatment and can lead to kidney damage if not treated promptly. Asymptomatic bacteriuria. In some cases, bacteria may be present in the urinary tract without causing any symptoms. While this condition may not require treatment in most cases, it is important to monitor for potential complications, especially in pregnant women or individuals with other health concerns. Causes of urinary tract infections: most UTIs are caused by bacteria, though fungi and viruses can occasionally be responsible. The most common bacteria involved in UTIs are Escherichia coli E. coli, which normally reside in the intestines but can enter the urinary tract through the urethra. Common causes and risk factors include poor hygiene, wiping from back to front after using the toilet, or not cleaning the genital area properly can introduce bacteria into the urinary tract. Sexual activity. Sexual intercourse can introduce bacteria into the urethra, particularly in women due to the anatomical proximity of the urethra to the vagina and anus. Urinary catheters. Use of urinary catheters, e.g., for long-term medical conditions, can increase the risk of bacterial infection in the urinary tract. Urinary retention. Conditions that make it difficult to fully empty the bladder, such as an enlarged prostate in men or certain neurological conditions, can increase the risk of infection. Diabetes. People with diabetes may have higher blood sugar levels, which can encourage bacterial growth in the urine, increasing the risk of UTIs. Pregnancy. Pregnancy causes hormonal changes and physical changes to the urinary tract that may increase susceptibility to UTIs. Weakened immune system. Conditions that weaken the immune system, such as HIV/AIDS or the use of immunosuppressive drugs, can make it more difficult to fight off infections. Anatomical abnormalities. Structural problems in the urinary tract, e.g., kidney stones or urinary tract abnormalities, may make it easier for bacteria to grow and cause infections. Menopause. Postmenopausal women experience a decrease in estrogen, which can alter the urinary tract and increase susceptibility to UTIs. Dehydration. Insufficient fluid intake can reduce urine flow, allowing bacteria to multiply in the bladder. Symptoms of a UTI. The symptoms of a UTI vary depending on the part of the urinary tract affected and the severity of the infection. Common signs and symptoms include frequent urination, feeling the need to urinate often, even if little urine is passed. Painful or burning sensation while urinating, a common symptom of UTIs, particularly bladder or urethral infections. Urgency, the strong and immediate urge to urinate, often accompanied by discomfort. Cloudy, dark, or foul-smelling urine. Urine may appear cloudy or have a strong odor. Blood in the urine. Hematuria. Blood in the urine may cause it to appear pink, red, or brown. Pelvic or lower abdominal pain, discomfort or pressure in the lower abdomen or pelvic region, particularly with bladder infections. Fever and chills. If the infection has spread to the kidneys, pyelonephritis, fever and chills may occur. Nausea and vomiting. These symptoms are more likely when the infection has reached the kidneys. Diagnosis of a UTI. To diagnose a UTI, a healthcare provider will typically conduct the following: medical history and symptoms, a discussion of the patient's symptoms, medical history, and risk factors for UTIs. Urine sample. A urine sample will be collected to check for the presence of bacteria, white blood cells, and red blood cells. This is usually done via a urinalysis microscopic examination of urine and urine culture to identify the specific bacteria causing the infection. Physical examination. A pelvic or abdominal exam may be conducted to check for tenderness or other signs of infection. Imaging or cystoscopy. If the infection is recurrent or severe, or if structural issues in the urinary tract are suspected, imaging tests like an ultrasound or CT scan or cystoscopy, a procedure that uses a small camera to examine the bladder and urethra, may be recommended. Treatment of urinary tract infections. The treatment for UTIs typically involves antibiotics to eliminate the bacteria causing the infection. The specific antibiotic prescribed will depend on the type of bacteria identified in the urine culture. Antibiotics. The most common treatment for UTIs is a course of antibiotics. Common antibiotics for UTIs include trimethoprim/sulfamethoxazole nitrolfurandiinfostomycin ciprofloxacin or other fluoroquinolones for more severe infections, though these are used less frequently due to resistance concerns. The choice of antibiotic depends on the severity of the infection and local antibiotic resistance patterns. Pain relief. Over-the-counter pain relievers like ibuprofen or acetaminophen can help alleviate pain and discomfort. For bladder infections, phenazopyridine may be prescribed to relieve pain, burning, and urgency during urination. However, this medication should only be used for a short period due to potential side effects. Hydration. Drinking plenty of water helps flush bacteria out of the urinary tract. Treating underlying causes. If the UTI is caused by an underlying issue such as a kidney stone, anatomical abnormality, or urinary retention, addressing the root cause may be necessary to prevent future infections. For recurrent UTIs. If UTIs are frequent, long-term low-dose antibiotics or a regimen of self-administered antibiotics after intercourse may be recommended. Probiotics, particularly those containing lactobacillus, can help maintain the balance of healthy bacteria in the urinary tract and may reduce recurrence. Preventing urinary tract infections. While UTIs cannot always be prevented, there are several steps women can take to reduce their risk. Wipe from front to back. After using the toilet, always wipe from front to back to avoid transferring bacteria from the anus to the urethra. Urinate after intercourse. Urinating after sex can help flush out bacteria that may have entered the urethra. Stay hydrated. Drinking plenty of water helps flush bacteria from the urinary tract. Avoid irritating products. Avoid using irritating products like douches, perfumed soaps, or feminine hygiene sprays, as they can disrupt the natural balance of bacteria in the genital areas. Wear cotton underwear. Cotton allows the area to stay dry and reduces the risk of bacterial growth, compared to synthetic materials. Avoid holding urine. Empty the bladder regularly to avoid allowing bacteria to multiply in the urinary tract. Consider cranberry supplements. Some studies suggest that cranberry products may help prevent UTIs by preventing bacteria from sticking to the urinary tract walls. However, evidence is mixed, so it's best to consult a healthcare provider before using them as a preventive measure. When to seek medical help. It is important to seek medical attention if symptoms of a UTI do not improve after a few days of antibiotic treatment. There is a fever, chills, nausea, or vomiting, which may indicate that the infection has spread to the kidneys. Pyelonephritis. You have recurrent UTIs or a history of UTIs with complications. Blood is visible in the urine. Conclusion. Urinary tract infections are common, especially in women, but they are usually treatable with antibiotics. Early diagnosis and treatment are important to prevent complications, such as kidney infections. Good hygiene, hydration, and lifestyle modifications can help reduce the risk of developing the UTI. If you experience symptoms of a UTI, seeking prompt medical care is essential for effective treatment.